The electrocardiogram, or ECG, is a representation of the electrical activity of cardiac muscle as it changes with time. Like other muscles, cardiac muscle contracts in response to an influx of positive ions into the cell. This means the cell's membrane potential becomes more positive relative to its surroundings, a change known as depolarization. It is the sum of these changes that is detected by electrodes on the surface of the body in an ECG. If the heart is beating normally, the cardiac cycle begins with a spontaneous depolarization in a specialized area of the right atrium, known as the sinoatrial node. This depolarization then spreads through the atrial muscle fibers across the atrial septum to the left atrium. This is seen as the P wave on an ECG. In a normal heart, the atria and the ventricles are separated by an electrically inert fibrous ring. This means the only route of transmission for the electrical impulse is through another special area of the atrium, known as the atrioventricular, or AV node. The AV node delays the transmission of the electrical signal for a short time, resulting in a period where no electrical activity is seen. This is shown as a horizontal line on the ECG, known as the PR interval. After this delay, the wave of depolarization spreads down the interventricular septum through the bundle of His, which splits into left and right bundle branches. The wave then passes into the left and right ventricles via specialized tissue called Purkinje fibers. This depolarization of the ventricles is seen as the QRS complex on the ECG and is usually the largest part of the ECG signal. The first downward deflection is called the Q wave, the first upward deflection is called the R wave, the S wave is the next downward deflection. Because the muscle mass of the ventricles is much larger than the atria, the ECG signal of the QRS complex is far larger than the P wave. After the contraction of the ventricles, the heart muscle must return to its resting electrical state, a process known as repolarization. This is shown as the flat ST segment, an upward T wave in an ECG. The depolarization of the heart spreads from the atria to the ventricles. It is therefore from the superior to the inferior aspect of the heart. The wave of depolarization is normally to the left due to the orientation of the heart in the body and the greater muscle mass of the left ventricle. The overall direction of depolarization is known as the electrical axis of the heart. When the wave of depolarization travels towards a recording lead, it is seen as a positive or upward deflection of the ECG. When it is away from the recording lead, it is seen as a negative or downward deflection. That concludes our short lesson on the electrophysiology of the ECG. In the next lesson, we will look at the different ECG leads and explain how to interpret an ECG.